Hi, this is Jessica DaMassa with WTF Health. I'm here at iCEE.health, and joining me right now we have the queen of iCEE.health, is Lorena Macnaughtan, and she's the person who really put together the healthcare stream within iCEE. So welcome, Lorena. It's a pleasure to have you.
Thank you, Jessica, and welcome to Romania.
Thank you. I'm so happy
to have you with us.
Thank you. Thanks so much for having me. So for those who are watching, explain the whole concept of iCEE, and not just the health part of it, but the whole thing, and then how the health part fits in.
I think that's really what's amazing also about iCEE.health. iCEE Fest is an event in digital innovation, all things digital, if you want. And the healthcare satellite event sits within iCEE Fest. And then you have a lot of synergies because we see so much convergence right now in the healthcare space from so many areas, from digital marketing, if you want, like digital communications, to virtual reality and so on and so forth. And this is very interesting, actually, to see how all these things connect on the spot right here, how this presentation fits with the other one on the other stage. And yeah, so this is about the fest itself.
It's incredible.
The founder, I should say, Dragoș Stanca, he is really the one who started this revolution here 7 years ago.
No, it's definitely got a cool energy. So for those who are watching, we are in a movie theater in a mall, and this is where this takes place. And so it's got a lot of people passing through, a very young crowd here because there's a lot of digital communications things being promoted. And I don't know, it's got a really cool grassroots kind of vibe to it. Very tech. So fit in the healthcare piece for me. So what did you try to accomplish? You had 44 speakers just today, which is insane. So tell me a little bit about what you were trying to accomplish there on one stage.
To my defense, we had three stages.
Okay.
The theme for this year, we had two themes in fact this year. We had like the future of the hospital and the clinic and new models of service in healthcare. And the centerpiece, I shall call it, was dedicated to the patient, whatever we don't talk about in healthcare. So we started a conversation on unmentionables in healthcare in Romania. And we also had a special moment, anti-stigma, if you want, on the main stage of the festival, so not only on the health stage. So we had a lot of art, and we even had a talk on what is love, the role of connection into the impact on our health, and also on health services. I mean, that was a great talk from Xenia Benifar. We also, of course, we have a lot of cool innovation that's coming out all the time. We had talks about artificial intelligence, about digital therapeutics, virtual reality, of course, and so many others. So it was a very, very packed day for health.
No, I would like you to put something in context that you just kind of breezed past, but you had mentioned the unmentionables and bringing up this conversation here in Romania. For everybody who's watching who don't really understand how important that is, provide some context around that. Yeah.
Well, I will give an example from a study that was recently published showing that loneliness kills as much as obesity. And I would also throw in a number and why it is important to start this conversation in Romania, because Romania, for instance, covers only 6% of the palliative care needs in this country, which is like really frightening number. So I think it's important in this space to bring forth these sorts of conversations. So it's very significant for Romania, but I think it's still very significant anywhere else in the world. But yeah.
No, anybody who's taking a bold stance and bringing up things that people find difficult to talk about, it's internationally important to be doing that. So thank you.
Thank you.
So no, but I wanted to continue on. I wanted to ask you a little bit about some of the things that we're hearing here at iCEE Health. So what were some of the key takeaways from the program that you've seen?
From the health stage, in that sense. Well, the key takeaway, and I think that's what we take from most of the conferences in innovation in health, is that we are still struggling, changing the culture of health to become more centered on the patient. But that's a really, to pay more attention to the patient as a person. Because in the current healthcare systems, we see mainly the problem that the person presents with rather than the person who has the problem, who has a medical
Right.
problem. So I think that's a big, we are still struggling making that push, but also when we have this new regulations in Europe regarding the data, the private data, I think that this is helping to shift a bit towards the patient, to shift the control towards the patient. So yeah, it's part of that work to change a bit the mindset, to be the culture, but also inspire a bit. I think there is a lot, the crossroads of arts and technology right now that is happening. And art elevates, brings, the human touch, the empathy, and so on. So this will be the this is our main effort. So on one hand, we do present technology and what is cool. On the other hand, we try to highlight, how all these new solutions, they actually push towards changing a bit the perception and being more inclusive. And we even had a talk with Shona Butler on nurses being a bit underrepresented in innovation in healthcare and why we need to make a bit more space.
And these are all great things. And so what has you, I guess, optimistic about the future?
Oh, the fact that we are here talking about that's pretty optimistic. I guess it's so much passion in digital health, and it's been for years now. And I think that's very exciting. I think that you see so many people getting in healthcare, trying to solve problems. Some of them are amazing problems. I think that's really optimistic. We live at an amazing time now.
Good. Well, Lorena, thank you so much for stopping by and talking with us. It's a pleasure to have you. Oh my gosh, my pleasure. Thank you so much for sharing all of this with me. I'm Jessica DaMassa with WTF Health. Thank you for joining us.